just curious what brings you out to the IMG Symposium this evening.
I'm just trying to know the opportunities available for IMG. So hopefully I'll educate myself more on those opportunities.
We are curious to see what the AMA is going to be discussing regarding the IMGs. And being one of the physicians who works, I would be curious to see what guidelines are coming out and what the new paper is going to be.
Yeah, I'm a medical student aiming for residency, so I would like to know how AMA work goes on today, because it's the first time I'm attending this.
Let me introduce the panelists. The first is Avi Bajrawal.
When I started to work on this area, people used to tell me, ask me what is there to talk about IMGs. It is an incredibly fascinating topic to talk about. It has multiple facets to it. You know, it has anthropological, economic, medical, literary, political, and ethical perspectives on IMGs.
Next we have Dr. Jayesh Shah.
IMG comprises 25% of the physician workforce in this country. So if you see and look around, one in every four physician is at IMG.
Also, I'd like to introduce Dr. Hugo Alvarez.
A lot of her colleagues have aged significantly more than her. Is that essentially her class broke down in two groups. One group of physicians who had entered administration or politics and were doing okay. And the other class who, for the most part, were actually the brightest in the class, who were working 3 jobs to make ends meet.
This healthcare reform talks about 40,000 more insured patients, but does not talk about how we are going to take care of them. With increasing medical schools here and in offshore, the chances are that in future IMGs may not have any residency spot left for them.
A former member of the Governing Council, and I am so proud about this wonderful paper.
There are 941,000 doctors plus in the United States, and of that, 243,000 IMGs, which is about 26%. Now, my question is, do we have statistics as to how many IMGs are members of the AMA?
My main concern right now is that we are fighting for the healthcare disparities in the provision of healthcare to patients in this country, but we're forgetting the healthcare disparities that are occurring in the providers of the healthcare in this country. There's a great threat ahead for immigration purposes on IMGs. There's a great threat on visa granting. There's a great threat ahead on the increase in admissions to the American medical schools.
It's not easy sitting up there at the podium answering these questions.
Oh, right. You gotta carry on. You can bring it up.